Well, our objectives here tonight are to gain some knowledge about how body weight, diet, and activity can influence your cardiovascular health, at least my talk is, and help you identify some of the cultural barriers to healthy weight management, because Dr. Berzenstein has talked a lot about some of the microsystems, whether that's in your brain or your hormonal balance or your personal decisions. But I'd also like to highlight that we don't do this alone. We're very social animals, and we have to think about both the micro and the macro systems that we find ourselves in. And I'd like to help you think about some actions that you can take in order to improve your quality of life and try to be free of disabling heart and vascular disease. So the reason they asked me to come here is that cardiovascular disease does remain the leading cause of death in the United States. Now, this is from the last vital statistics report that's available, and it shows that the top line, the blue line, is diseases of the heart, which remains our major killer, has for some time, and is now very close to the number of cancers that people die from. And this is really speaking to our great public health efforts that have decreased the amount of accidents and infectious diseases that claim us earlier in our lives. And our main challenge now is really to face the consequences of the more chronic diseases that plague us, which are often environmentally influenced and influenced by our behavior. The next blue line that you see, number 3 in the killer, is stroke. And the underlying mechanisms of that are very similar to what we have for heart attack, which is plaquing of arteries and blockage of those arteries causing damage to the tissue. And then the third one, the red line, is hypertension. So between those, cardiovascular disease claims a lot of lives. And no matter how much life we have, we always want more. But it's not just more that we want. We want meaningful life, and we want to be able to do the things that we do. So I'm going to talk about the roots of cardiovascular disease and some of the mechanisms and how they relate to healthy weight management. And the first one is about fat. Okay, cholesterol. Fatty streaking begins in our arteries during childhood. This happens to everyone. What happens in this vascular wall is that cholesterol will pass by the lining and will be taken up. And there's a gradual buildup of cholesterol plaque in our arteries over time that eventually leads to this kind of thing, either blocking the arterial wall entirely or becoming what we call unstable and breaking apart and causing clot that then completely blocks an artery, leading to tissue death downstream of that blockage. So this is happening. This is happening in our kids, just like they have fatty streaks and fatty livers. This is happening, and it's happening to you and me. And what determines whether or not we have symptomatic disease is really a combination of genetic factors and our environmental factors that accelerate this process towards symptomatic disease. So do fats matter? Yeah, fats matter. So the other big thing in terms of development of heart and vascular disease really has to do with mechanical stress and strain. So the big one that's a risk factor is hypertension. It's called the silent killer because there really are no symptoms at the beginning. And you can go years and years if you don't have regular screening with hypertension and never know it. And the thing that's difficult about hypertension to deal with is the changes that happen in the heart muscle itself and in the tone of the blood vessels over time. So the heart will get thick, and it will get stiff, and it will lose its elasticity. And these changes will then lead to increased wall stress in the heart, inability to get enough oxygen to the full thickness of the heart muscle, and it will lead to reduced efficiency of the entire cardiovascular system, not just the heart. There's a combination of inflammation, oxidation, and the immune system that is very active in the vascular wall on a minute-by-minute basis that can change even with smoking a single cigarette, that can change with eating the French fries in the fat that has been reused just once. So the major contributors to heart failure include hypertension. A third of the people over the age of 20 have it. And of those who are aware of the diagnosis, about half are uncontrolled. How about coronary artery disease? Yep, that's a big one. 7% of people over the age of 20 have that. 8% of us are diabetic in adult life. And 18.3 million have been diagnosed in the US, but it's estimated that another 7.1 million have gone undiagnosed. Now, other things include family history of heart failure, hyperlipidemia, high cholesterol, over 15% of adults have that. Tobacco smoking, shockingly 20% of our young people smoke. And they don't stop when they get older. And 36 to 53% of us have detectable amounts of nicotine metabolites in our system, which means that there's a lot of secondhand smoke going around. Big contributor. Obesity itself, so a BMI, body mass index, greater than 30. A lot of us have that. And metabolic syndrome. And metabolic syndrome is the combination of being overweight or obese, having high cholesterol, and having glucose intolerance or a diabetic or a pre-diabetic state. So as a nation, we're not doing so well on this. Lots and lots of us have risk factors for disabling cardiovascular disease. So how did we get here? You know, are things really that different from 20 years ago? As Dr. Bernstein said, absolutely yes. These are a little bit different years, but same concept. This is 20 years. And the obesity map showed Iowa at 10 to 14% of us having a body mass index greater than 30. And here we go in 2010, 25 to 29%.